Hello, everyone. My name is Kay McQuinley. I'm with Neuro Devices. Today, we're going to be talking with Dr. Ron Delano with Cervigard Spinal Bracing Corporation. He's going to go over a presentation to talk about the Cervigard technology and its use in your practice. Ron?
Okay. Hello to all the doctors who are part of this new program. This is an exciting new technology that you're going to absolutely love in applying it to your patients. The results you're going to see on your x-rays are going to be nothing short of amazing. The title, neck pain caused by forward head posture and loss of cervical lordosis. Now, that title can apply to a lot of injuries, and whiplash is one of the main ones. But as you all know, we have this situation developing not only with whiplash, but with the chronic use of electronic devices, where people are looking down at these phones and computers for long hours every day, especially after the COVID years. They have developed a pattern in posture that is absolutely pathogenic. So let's look at some of the slides that help us see this, not only for ourselves, but for our patients, and then they can understand what we're dealing with. First slide here is a forward head posture example. FHP is how we know it. All of us have posters in our office about forward head posture. It's also known as other names: anterior head carriage, tech neck, a lot of different terms. But the pictures on your right are some you see in your office all the time. So here's a picture of the top x-ray, heads forward. The ears are forward of the shoulders. If you look at the upper back, there's a hunching. I'm going to mention this several times during this presentation because this is the profile that the patient brings to us after their auto accident injury, and they're under our care for treatment. The head is forward, the ear is forward of the shoulders, the neck is straightened. See the circled red area? As the head translates forward of the shoulders, the head has a progressively more impactful weight strain on the neck itself going down the entire spine. The bottom x-ray, you see the head in a normal posture. The head is over the shoulders. There's a nice curve to the cervical lordosis, and the head position is over the shoulders. The hump in the upper thoracic is not as apparent. Here's a profile you see of the patient on the right. This is what they look like when they come to our office. We like to photo all the patients with their own cameras as well as ours, so they can see how bad their posture is. Their commitment to care is enhanced if you do that. If you look to your far left, that's this person's x-ray. Heads forward, the neck is straightened. If you look at the suboccipital area, the rectus capitis posterior minor muscle area, that gap between the cranium and the atlas posterior arch. Now look at the center picture, and you compare the various items that we're measuring. The head posture is much better. There's a lordosis, not a perfect one, but a better lordosis than they had in their standing posture. The rectus capitis minor space right in there between the occipital area and the superior aspect of the arch of atlas is now opened. The jaw is now lined up. This is what you'll get. Now, this technology will do this for you in conjunction with your adjustments. This particular slide is to show you the various aspects of what you want to do. It corrects the forward head translation, restores the normal cervical lordosis through the initial weeks of in-office care. Use of the collar translates to daily use at home for 20 minutes per day over a 6-week period, followed by your reevaluation with x-ray or posture analysis, or both. You see the gentleman putting the collar on. His hands are turning the knobs as the cheek pads on either side of the nose are moving the head rearward. This causes a true translation correction. We don't want an extension correction. We want a translation correction. This is doing that. You see to the right of that gentleman is the person sitting back in a chair. So the office space you have to utilize after you adjust a patient and put the collar on them is simply sitting in a chair, allowing the person to lie back a little bit to allow gravity to help pull the head back while the collar is working to correct the head neck complex. The bottom 2 x-rays shows you before and after. We like to show pictures like this because a picture is worth 1,000 words. When a patient stands next to the poster in your office of forward head posture, regardless of which one you use, notice the big dramatic improvement of the posture relative to the era noted on the poster. So picture is worth 1,000 words. Helps with patient compliance and understanding what you're trying to do for them. This is a case of a 60-year-old female. Some of these cases were impossible to correct in the past without the use of the Cervigard technology. In the upper corner, left-hand corner, you see the straightened neck. She has diffuse DJD throughout the entire cervical spine. And then on the right of that is the corrected spine. Now, if you look at the right two pictures on the lower right-hand corner of the slide, you see the patient when she came in, we put the collar on her. That's the correction potential x-ray. And the x-ray to the right is done several weeks later to show the remodeling of the head neck complex. Now, previously, to get this on a patient with diffuse DJD was extremely difficult, if not impossible. Now, with the Cervigard collar, you can make those kind of corrections. Another case, forward head translation, upper left-hand corner. This is a 53-year-old female. There is DJD at the C6, 7 area, DJD. The arrow at the spinous of the 7th cervical shows you where some of the adjusting forces are going to go on this patient before we put the collar on her. And then the picture to the immediate right is the patient with the collar on. And you see the nice lordosis in the cervical spine. Look, that yellow arc line, that's a lordosis line from the annotation tool given to us in the x-ray marking of the digital x-ray machine. You'll also notice that the head posture is back. The ear is over the shoulder. Excellent. On the right-hand side is the posture of the patient. 8 weeks later, nice correction, even though they have degenerative joint disease. This is our alpha patient. You'll see the original prototype collar there with the 3 fulcrums in the back of the neck. At those days, we were using the fulcrum depending on where we saw the x-ray, on the x-ray, to break down of the cervical curve. In this case, we chose the middle fulcrum. Over time, we realized that the correction support had to be between C4 and C6. And now we have 1 fulcrum in the back that glides up and down depending on where the doctor wants to put it. If you're unsure, leave it in a down position. Over 90% of the people are benefit from that position. That's our default position. So if you're unsure, you don't have x-rays, leave the fulcrum down. If you have x-rays, you have the liberty to do what you wish to do in terms of where to support the neck. You look at the 2 pictures with and without. This is about a 10-week period. Nice remodeling. Next. Here's another patient. If you look at her x-rays in the center, I'm not going to go over the symptoms here. You can read them yourself. We all have these patients. We know what they have. They all present the headaches, the neck pain, the paresthesia in the arms, hands, and fingertips, balance issues, grip issues with their hands. These are all symptoms that we see get corrected and improved upon once the Cervigard collar is applied to the treatment protocols. So you see her x-ray in the center. That's her starting posture in the left x-ray. The right one is the corrected posture 7 weeks later. Look at her and the x-ray, excuse me, the photograph of the young lady shows her ear over the shoulder in the corrected posture. Another patient, if you look at his x-ray on the left, severe DJD. Now, these are the toughest patients you'll ever see in your practice, the ones that give you nightmares, make you work overtime to try to fix. Well, now it becomes a lot easier. You give them their adjustment in an area of the neck that needs to be adjusted, and then you put them on the collar afterwards, sitting in a chair for 15 to 20 minutes, and allow the Cervigard collar to remodel the head neck complex after you deliver an adjustment. Look at his neck on the right x-ray with the collar on now. You see the head over the shoulders and the neck curve improving a little bit. Now, this person's curve with all that degenerative joint disease, and actually almost looks like fusion in the lower cervical spine. You're never going to get a perfect lordosis. And these kind of films serve you well in your reports as you give progress reports to the insurance carrier as well as the legal counsel, and help you measure degrees of impairment on this patient so that you help the lawyer at the end of the case with the arbitration. So post x-rays, post posture, x-rays are obviously the most effective measure to make your case about what degree of improvement the patient has and what degree of impairment in your opinion, the patient has, and that justifies your statements. Your lawyers will absolutely love this because now they have objective evidence from which to arbitrate. Here's a patient we see a lot. This is the profile: the forward head carriage, the rounded upper thoracic spine. And this is an older patient. We're going to show you a teenager in a few minutes with the exact same posture. And but with the older patient, it's very resistant. Now, we tried to get this man's head over his shoulders. We manually adjusted it. We tried the posture, bring it back. It was like rubberized. It was such a we call it a rigid ligament complex. Well, the ligaments, the posterior ligaments around the neck area had hardened and he would not move. So we sat him down in a chair like you see in the picture on the right, and notice his ear now is over his shoulders relative to the first picture. And he sat there for 15 to 20 minutes, in this case, 20 minutes. And after just a few days, he started to feel the relief. I don't know if we would have been able to get this kind of correction on this gentleman if we didn't have the Cervigard collar to apply. So, but this is now a classic profile of what you're going to see in your patients. So we really encourage all of you doctors to, in addition to the x-ray, just take a photo and share the photo with the patient. And that photo becomes also part of the documentation for the degree of impairment down the road when you compare it against the best correction posture you receive in that patient. Another patient with severe forward head posture and rounded shoulders. So we went one step further and we put a fulcrum at the T1, T2 area. Why did we do this? Well, when she sat down, some of these people, their whole thoracic spine needs to be remodeled. So perhaps in our clinic, we all do something for that. Sometimes it's two-way traction. Sometimes it's laying on blocks. We all have different methods. When using the Cervigard collar, in this particular case, we wanted to use a soft fulcrum. So this was a pool noodle, and it happened to compress enough so that the patient could still lean back and let the collar correct the head-neck complex. Here's two people wearing the collar, and they're different ages. The older lady is in her late 70s. Notice that because of rigid ligament complex or stiff neck, if you want to call it that way, older folks don't have the flexibility of younger ones. Notice that her ear is still moving back over her shoulder, the older lady, but notice the track. We only were able to go halfway along the track because of her resistance in the head neck complex. But the younger patient in the early 40s, we could go back on the track almost 2/3 of the way, or 3/4 of the way, excuse me. So the younger people, you can be more aggressive. We use the 40-year-old rule. If a person is over 40, do it progressively over time. If they're under 40, you can be a little more aggressive. Here's the young lady I was telling you about. I think this child was 14. Look at the profile of the x-ray on the left. Forward head translation. Look at the horrid reversal of the lower cervical spine from C3 right through to the upper thoracics. She has a kyphotic configuration. Now you can just imagine what will happen to this child in the next 4, 5, 10 years of her life, 20 years, if that isn't corrected. On the right is the immediate correction potential x-ray. We call it the correction potential because when you put the collar on, we make the maximum correction adjustments on the collar to see what the benefit would be on the x-ray. So in this case, you see the head back and the nice lordosis of that reversal she had previously. So once this child receives this technology, over time, 6 to 10 weeks, it'll remodel the head neck complex and possibly save this child's life. Next. This is an older patient. The adjustment is at the C5 vertebra. You see the arrow on the left x-ray where the reversal is. So your adjustments would be directed in that area. And then after the adjustments, you'd want the fulcrum on the collar in that same area to help rehabilitate the curve. Now, if you look at the x-ray on the right, you can see the immediate correction in that patient of the cervical lordosis and the head posture. Doctors, I don't believe you've ever seen anything in our profession that can make these kind of corrections this quickly. Now, once you put the collar on, you see that nice correction. They're not really there yet. It's going to take 6 to 10 weeks for that to remodel. That's why we want to do it after our adjustments and in the office. And then later on, several weeks later, they can transition to home care once they get used to putting it on themselves. There's a small learning curve. It's not hard, but it does take 3 or 4 times putting it on and off for the patient to get it. Next. Again, we're big believers in pictures are worth 1,000 words. If you look at these are 2 cases where the x-ray was demonstrating the correction of the collar. On the lower picture where you see the young lady, her actual x-rays are behind her. This is extremely powerful because the patient's now seeing the technology, getting their ears over the shoulder, and they're seeing the x-rays behind them showing that powerful correction. I can't tell you how that affects the patient. When they see that, they are not only excited about the care, they're bringing in their family members to help them to also see if this would benefit them. So it's a great referral tool. It's a great patient compliance tool, and it's a great arbitration tool for you to use in your reports with the legal counsel. I want to thank you for your participation in this time and listening to the presentation itself. If you have cases that you would like to discuss with us once you've applied the Cervigard technology to them, particular cases with large herniated discs or spurs, and how you might adapt a collar, we're available for consultation through appointments with Kane McQuinley. Thank you for your attention.
Yep, like Ron just said, if you have any questions, especially clinical, come through me first, and I'll make sure that Ron gets them, and we'll evaluate them and answer them in a appropriate time. All right, thanks everyone.